your presentation, you explored the structural and compositional heterogeneity of amyloids. What implication does this heterogeneity have for understanding the pathogenesis of amyloidosis and for early disease diagnosis?
That's actually a very key question. I would say that the variability in the structures that I've mentioned today and that I described today, they can have a pretty big role when it comes to the pathogenesis of transthyretin, because, we have the same clinical variability in the symptoms of these patients, the onset of these patients, the organs that are implicated, and the, how they call it, the aggressiveness of these mutations, for example, that they vary, the differences between male and female. So all of that, I think knowing the molecular basis of the structures can bring some light into it. Now, we are far from understanding everything, but we're learning a lot. And when it comes to early diagnosis or detection, I would say that also as well, because at the end of the day, what you want to detect is the formation of these structures. So if you understand these structures and these shapes, you could design things that are specific to each of those, or things that are common, or they can detect all of them at the same time.
What feature do you consider essential for these biomarkers to improve disease diagnosis and monitoring compared to current tools?
So I would say that in the case of the one that I mentioned today, and another one that is also in development as well, I would say that the key or the difference between those and the ones that are in the current clinic, currently in the clinic, is the fact that they are targeting something that is specific to disease. So they're not targeting transthyretin normally, like healthy transthyretin, which is something that everyone has. So it's not targeting things that are related to the symptoms or the pathology. They're actually targeting the disease agent, right? The things that are causing disease, which is the aggregates themselves. So that's one thing. Another thing that I would say is that, and those are key important things for these biomarkers and to keep in mind, is that they should be able to detect the disease early. Like, I'm not talking about once you have already symptoms. I'm talking about years before that. So you can start treatment way earlier. And also, they should have some sort of response when it comes to treatment. Like, you can actually see or follow the progression of the patient with and without treatment. And maybe you can make informed decisions on which therapy is best for each of these patients.
Considering the results of your research, what are the next steps that could bring us closer to more targeted or personalized therapies for patients with amyloidosis?
That's actually a great question, because this is pretty much the key of why we study the structures, is that it makes us see how each of these patients is actually forming their fibrils. So at the end of the day, the future is to design therapies that are targeting each of these structures specifically, and combining early detection that are also personalized with personalized treatment. That would be, like, I mean, at this point it's sci-fi, right? It's science fiction, but I think it would be the future of this field. It's understanding the structure of each of the patients, having like an easy test to see which structure, which shape these fibrils are forming, and then having a personalized therapy that is targeting that particular structure.